Hello everyone. In this chapter, Shock and Bleeding, we'll introduce the cardiovascular system and the management of shock and bleeding. In this chapter, you'll find out the three components of the cardiovascular system and their respective functions. You'll also learn how to identify the signs and symptoms of internal and external bleedings and their management. Furthermore, you'll learn the definition, types, signs and symptoms and management of shock. Let's begin now. The human cardiovascular system comprises the heart, blood vessels, and blood. Its major function is to carry oxygen, nutrients, and hormones to all body cells, and remove carbon dioxide and wastes produced by metabolism. Starting from the heart, the cardiovascular system pumps blood throughout our body and back to our heart via blood circulation and heart contraction. To understand the cardiovascular system, we need to understand the core of the system, which is our heart. The heart lies between the breastbone and the backbone, in the middle of both lungs and above the diaphragm. It's a hollow, muscular organ about the size of a fist. Its apex shifts slightly to the left, and the heart pumps blood all over the body and maintains blood circulation. The heart is divided into right and left sides with upper and lower chambers of each, namely atria of the upper chambers and ventricles of the lower chambers. Now we'll talk about the passage of blood, which are blood vessels. There are three types of blood vessels, namely artery, vein, and capillary. Arteries have thicker walls that are tough and elastic, as blood is pumped out from the heart to other parts of the body through arteries. Arteries mainly carry oxygenated blood, except pulmonary artery. Veins have thinner walls and most of them have valves to prevent blood from flowing backwards. Except pulmonary veins, all veins carry deoxygenated blood from different parts of the body back to the heart. Finally, capillaries connect arterioles and small veins. They are where gaseous and nutrients exchange take place. Just like in a freight transfer station, our body cells load oxygen and nutrients from the blood and unload carbon dioxide and wastes. After talking about the passage of blood, we'll move on to the transport medium, blood. Blood is what passes through blood vessels. It accounts for about 7% of the total weight of an adult. In other words, for a 70-kilogram adult, the blood volume will be around 5 liters. In general, blood volume of an adult would be around 5 to 6 liters. Its major functions are to transport oxygen and nutrients, carbon dioxide and wastes, hormones and antibodies, as well as fighting against infection. Plasma is the fluid part amounting 55% of blood volume and holds the red blood cells, white blood cells and platelets in suspension. Red blood cells contain hemoglobin, which carries oxygen and some carbon dioxide. Hemoglobin is in fresh red color when combines with oxygen and becomes dull red when combined with carbon dioxide. Red blood cells are made by bone marrow, with each of them lasts for 100 to 120 days. White blood cells mainly help fighting against bacterial infection and produce antibodies. They only last about 30 days. Lastly, platelets help in blood clotting. Blood circulation can be divided into two parts. They are pulmonary circulation and peripheral circulation. Oxygen is carried to each and every part of our body through pulmonary and peripheral circulations. Let's start with pulmonary circulation. When the ventricles contract, deoxygenated blood will flow from the right ventricle through pulmonary artery to the capillaries of alveoli in the lungs, for gaseous exchange. After that, oxygenated blood flows back to the left atrium through pulmonary veins. This is the pulmonary circulation. As for peripheral circulation, it refers to the flow of oxygenated blood pumped out from the left ventricle through the aorta to different parts of our body. The blood will bring oxygen to cells and tissues and collect carbon dioxide from body cells. Afterwards, deoxygenated blood flows back to the right atrium via superior vena cava and inferior vena cava. Each heartbeat creates a wave of pressure as blood is pumped along the arteries. It's how pulse is created. Under normal conditions, adults have 60 to 100 beats per minute. Strong and healthy adult may have a lower rate. Children have 80 to 120 beats per minute, while infants 120 to 140 beats per minute. Moreover, pulse rate can be altered by panic, heat, loss of blood, irregular heartbeats, increase in intracranial pressure, or other medical conditions. Normally, you can measure adult pulse at the wrist, which is called radial pulse. But in first aid, pulse at the neck, which is called carotid pulse, is usually measured. For babies, the pulse in the upper arm, which is called brachial pulse, is usually measured. When checking a pulse, you should record the rate, strength, and rhythm of the pulse, such as checking if there's a regular beating. Blood pressure is the force that is exerted by the blood flow through the main arteries. Normal blood pressure for an adult lies between 90 to 139 mm of mercury for systolic pressure and 60 to 89 mm of mercury for diastolic pressure. Children's blood pressure is usually lower than that of adults. The pressure also varies with age, gender, arterial diseases, strength of the heart contraction, emotion, and conditions of the arteries. After learning about the cardiovascular system, we'll proceed to the definition, signs, and symptoms, as well as the management of shock. How can we tell whether a condition is a shock? Shock is a life-threatening condition that occurs when the circulatory system fails and causes vital organs such as the heart and brain to be deprived of oxygen. Low blood pressure is a later sign of shock. In fact, there are many different types of shock. The first type is hypovolemic shock, which is caused by blood loss in blood vessels because of external or internal bleeding triggered by trauma. Other causes include loss of fluid because of severe vomiting, diarrhea, or loss of plasma because of critical burns. The second type is neurogenic shock. The condition occurs when the autonomic pathways within the spinal cord is disrupted, causing dilation of blood vessels. As a result, low blood pressure occurs due to decreased systemic vascular resistance, resulting in pooling of blood within the extremities, and occasionally with a slowed heart rate. Neurogenic shock can occur after damage to the central nervous system, such as brain and spinal cord injury. The third type is cardiogenic shock, which is a medical emergency resulting from inadequate blood flow due to the dysfunction of the heart. It can be caused by heart diseases such as myocardial infarction, heart failure, heart conduction delay, arrhythmia, etc. Bruising of heart muscles due to blunt trauma on chest can also cause cardiogenic shock. The fourth type is obstructive shock, in which physical obstruction of the great vessels or the heart itself leads to poor blood circulation. The causes of the condition include pulmonary embolism, cardiac tamponade, and tension pneumothorax. The fifth type is anaphylactic shock, which occur as a severe allergic reaction caused by potential allergens. Common triggers include venom from insect bites or stings, inhalation of pollen, consumption of food items such as seafood or peanuts, and use of medications such as penicillin, aspirin, and non-steroid anti-inflammatory drugs. The last type is septic shock. In case of severe bacterial infection, the toxins released by bacteria in our body may cause blood vessels to dilate, and the abnormal distribution of blood flow in the smallest blood vessels results in inadequate blood supply to the body tissues, and finally develops septic shock. Most of the cases are caused by gram-negative bacteria infection, while gram-positive bacteria or fungus may also lead to septic shock. Shock is progressive deterioration which can be divided into two phases, and the victim's condition is deteriorated from phase to phase. Firstly, the compensated shock. The victim will experience normal blood pressure, rapid pulse, fast and shallow breathing, cold and clammy skin, anxiety, decreased urine output. And then, in the initial stage of decompensated shock, the victim will experience low blood pressure, confusion, no urine output. In the later stage, the victim will have extremely low blood pressure, coma, organs failure, or even death. If the victim suffers from anaphylactic shock, itchy skin, rashes, tongue swelling or breathing difficulty may occur in addition to above signs and symptoms. The victim may be at risk of suffocation, and first aiders should handle carefully. If the victim suffers from septic shock, fever or other signs of infection may occur. What should we do in case we suspect that the victim is suffering from shock? Apart from the primary survey procedures of DRABCDE, the most important thing is to send the victim to hospital as soon as possible. As you're waiting for the ambulance crew to arrive, you can try to manage the cause of shock. Keep the victim warm by covering him or her with a blanket, but not to get overheated. Do not allow the victim to eat or drink. Meanwhile, closely monitor the victim's level of consciousness, breathing, and signs of circulation. You can also comfort the victim and place him or her in supine position. Loosen tight clothing to reduce constriction at the neck, chest, and waist if necessary. If possible, do not leave the victim unattended. Bear in mind that the most important procedure is to send the victim to hospital as soon as possible. Then we'll talk about the signs and symptoms and management of bleeding. Bleeding means loss of blood from the damaged blood vessels, which can be categorized as external bleeding and internal bleeding. There are several situations of bleeding that require special attention. First, when bleeding is from main arteries. Second, when the victim has blood diseases such as hemophilia, low platelet count. And third, when the victim is on anticoagulant therapy, such as taking warfarin. These three situations should be handled with extra care as they are more dangerous. There are mild or severe external bleeding. Victims with mild external bleeding show stable vital signs. There'll be redness around the wound, swollen, and pain. Severe external bleeding shares the same signs and symptoms as shock. To manage external bleeding, first aiders should wear protective gloves before carrying out the primary survey of DRABCDE. After that, place the victim in a right position, examine and irrigate the wound. Then stop bleeding by applying direct pressure. Bandage the wound after bleeding has been stopped. In case of severe bleeding, we should prevent and manage shock and send the victim to hospital immediately. Now we'll use a flowchart to explain the differences in the management of external bleeding in different situations. Perform DRE-BCDE as primary survey. Continue to observe the conditions of the victim after finishing the above steps and check if he or she still has bleeding. If the victim has severe bleeding, call 999 for help immediately, while examining the wounds and using direct pressure to help stop bleeding. If bleeding continues, you should apply greater direct pressure to stop bleeding. Also, whether bleeding continues or not, you should prepare well for shock prevention. Continue to observe the conditions of the victim after finishing the above steps and check if he or she still has bleeding. But if bleeding still continues by then, you should add wound dressing and keep applying direct pressure. The victim is likely to suffer from shock in this case. Therefore, you should prepare to manage shock and send the victim to hospital as soon as possible. If the victim has no severe bleeding, you can carry out secondary survey and manage the wounds with mild bleeding. Send the victim to hospital as soon as possible if necessary. If no, you can bandage the wound and prevent shock. If bleeding stops, you can bandage the wound and send him or her to hospital when necessary. We'll now take a look at a few ways to control bleeding. The primary and most common way is direct pressure. As the name suggests, it refers to a direct application of pressure over the wound to stop bleeding. It's the most efficient, effective, and simplest way to control bleeding. When the situation allows, using direct pressure to control external bleeding is the most preferable option. The second way is indirect pressure. When there are foreign bodies on the wound or direct pressure isn't feasible, we'll use indirect pressure. It controls bleeding by pressing firmly on either side of the embedded object, placing padding on either side of the object, and bandage above and below the object. The third way is immobilization of the injured part. It helps slow down blood loss and is applicable to victims with fracture. Apart from the above three ways to control bleeding, there's a tool that can help control bleeding, which is tourniquet. Tourniquet is only used when the above three ways aren't applicable or when direct pressure isn't effective in controlling life-threatening bleeding. Tourniquet should be used with caution, and the starting time of its application should be recorded accurately. This method should only be applied by professional healthcare providers. After learning how to manage external bleeding, we'll move on to internal bleeding. Internal bleeding is the bleeding inside body cavities. It can be a very serious medical emergency depending on the location of bleeding, for example, brain, stomach, lung. Internal bleeding can be life-threatening without prompt and proper treatment. Major causes of internal bleeding include contusion, crush, fracture, and non-traumatic injuries. Apart from common signs and symptoms of bleeding, signs of shock may occur in severe cases of internal bleeding. If internal bleeding is caused by trauma, external wound may appear, and if the trauma involves abdominal organs, there'd be rigidity, tenderness, and pain. If bleeding is caused by contusion, there'll be redness, swelling, and pain. Another apparent sign and symptom of internal bleeding is that blood may come out with excretions or from body openings such as mouth, ears, or nose, or bleeding from urethra or anus. There are different causes and signs and symptoms of bleeding at different sites. Let's match the following. Your match is correct. Bleeding from ear can be caused by injury to the external or internal ear canal or perforated eardrum. Bleeding from the nose can be caused by rupture of blood vessels inside nostrils. If the victim has hematemesis, he or she may have bleeding in esophagus due to esophageal varices or esophageal tear. What are the signs and symptoms if below organs are bleeding? Are you sure to answer last three questions correctly? Your match. If the victim has abdominal pain or back pain, he or she may suffer from rupture or leakage of abdominal aortic aneurysm. Bleeding in urinary tract due to pelvic fracture and bleeding from the kidneys or bladder may cause red or smoky urine. In case of severe vaginal bleeding, it could be bleeding in the uterus due to miscarriage or postpartum bleeding. What are the signs and symptoms if below organs are bleeding? Your match is for internal bleeding in the lungs. Victim may cough up frothy blood sputum or even fresh blood. He or she may have ribs fracture or lung trauma. If the victim vomits fresh blood or coffee ground substances or passes tarry stool, he or she may suffer from bleeding in the stomach to upper intestine due to gastric ulcer or duodenal ulcer. Bleeding in lower intestine due to hemorrhoid or injury in colon may cause fresh blood in stool. Are you sure to answer? To manage internal bleeding, perform primary survey procedures DRABCDE. After that, carry out secondary survey to see if the victim shows signs and symptoms of internal bleeding. If yes, call 999 immediately for help, reassure the victim, and place him or her in an appropriate position. If the victim vomits, place him or her lying on one side. Bear in mind that you should prevent, manage shock while managing the wounds, and send the victim to hospital as soon as possible. Even though there's no signs of internal bleeding can be observed, the victim may still need to seek medical consultation if necessary. It's better to prevent than cure. To prevent injury and bleeding, you should be careful when you use sharps and put them back to a safe place where is out of reach of children after use. You should also handle glass debris, empty tins, and used razor blades with caution. If you have children, check if their toys have sharp edges or points. As long as you have taken good precautions, the chance of injury from accident can be minimized.